When a baby boy is born, we always want to make sure that both testicles are in the scrotal sac. If we find out that one or both testicles are not in the scrotal sac, then obviously we want to examine your baby to find out, are they in the groin, or we need to do an ultrasound to find out where they are, if they are still inside the tummy. We usually give enough time, maybe up to 6 months of the 6 months of age of that baby boy, to allow those testicles, the undescended testicles, to naturally descend on their own. If by the age of 6 months the testicle that has not descended still remains undescended, then we want to do a surgery which we call an orchidopexy, where that testicle that has not descended is identified and surgically brought down into the scrotum and then fixed to the wall of the scrotal sac so it doesn't go back up. So that orchidopexy is usually done at the age of 6 months. Before the child is 1 year of age, it has to be done ideally. If that testicle is not, descended surgically, or if it doesn't come down naturally, then it increases the risk of testicular torsion. So that undescended testis could twist, and then the blood supply gets cut off, and it causes lots of pain, and it's a medical emergency usually. Another thing that could happen is that it increases the likelihood that that male baby obviously could develop infertility as an adult male. Another thing is that a long-term complication could be testicular cancer. That undescended testis, either single or both of them, can then transform into a testicular cancer over time. So these are the reasons why we want to always make sure that both testicles, are fully descended in the scrotal sac. So if you're a parent, always make sure, if you have a male child, a boy, always palpate, gently feel to make sure the testicles are in the scrotal sac. Sometimes these testicles could, maybe when the child is exposed to cold or emotions, fear, anxiety, those testicles, one or both testicles could be pulled back up into the groin or sometimes even into the abdomen. We call that retractile testis. If that happens, also report it to your doctor. So we have to, examine that child and make sure it's not something that could then, get sucked or pulled into their tummy and then becomes undescended, So always examine, and if you have any concerns, report to your doctor in a promptly time frame.